Hi everyone, welcome to Lab 7, the Cardiovascular System. So in class it may have been labeled circulatory system or cardiovascular system. Either way, the difference is if you're including the heart in your discussion, then you're talking about the cardiovascular system. Circulatory system means all the veins and arteries that carry blood. Since we are going to be talking about both today, it's the cardiovascular system. So we are mainly going to be talking about the heart, and then we will talk about all of the major vessels that come in and out of the heart. So I'm in the real-time 3D thorax when you're trying to find it yourself. Okay, so what I'd like to do is start with some basic orientation. So what we're looking at here is the base of the heart and the apex, or the pointy bit of the heart. Okay, so this is the way the heart would sit in your chest. Okay, maybe tilted just a little bit more down, but I can't get it to do that very well, so we're pretty close. So general orientation, when you're looking at the anterior of the heart, here's what you'll see. The right atrium is this area here. The right ventricle is this area here. And right off the bat, I want you to notice that there will be a stream of blood vessels and little ditches dividing the atria from the ventricles and dividing them from each other. So as we tilt a little, this is the left ventricle, and again, lots of veins and arteries dividing the right ventricle from the left ventricle. So it's easy to see where that division is. To see the left atria, we have to flip around to the back, okay? And when we're looking at a posterior view, that's when we see a lot of the left side of the heart, okay? So now we're in a posterior, a sort of semi-posterior view. And what we see is right atrium, very easy to identify because of the very big blue veins going into it, okay? One kind of on the bottom, that's inferior vena cava, and one on the top, that's superior vena cava, okay? There's a little bit of your right ventricle. You can't see much of it from the posterior. And then we see our left side of the heart. So your left atrium is this area, and you can see all of these pulmonary veins going into it. Okay, there will be 4 of them. Okay, so 2 from the left lung, 2 from the right lung. So your left and right pulmonary veins. And we'll come back to those in a bit when we trace the blood flow through the heart. I will point out, since we're here, that as a note, don't forget that the pulmonary veins and arteries are switched with respect to oxygen content, okay? Because the pulmonary arteries are leaving the heart to get oxygen from the lungs, the pulmonary arteries are very low in oxygen, whereas the pulmonary veins that we see here are colored red because they are bringing highly oxygenated blood back from the lungs towards the heart, okay? So your oxygenation levels are going to be flipped for pulmonary arteries and veins compared to the other arteries and veins of the body. So that's your left atria, and then your left ventricle is this whole big situation here. And again, on the posterior view, your left ventricle and right ventricle are very clearly divided by a bunch of arteries and veins, okay? So very easy to see those divisions. And if we look up here, you can see that we also have very distinctive arteries and veins traveling between the atria above and the ventricles below. Okay, so from the outside of the heart, those divisions are really obvious. All right, we're going to go back to our anterior view. And I think the best way to go through all the vessels coming into and out of the heart is to just follow our path of blood through it. So we'll start up here. The superior vena cava is bringing poorly oxygenated blood. I'm not saying deoxygenated because there is still oxygen in the blood, even though it's already been through the body. It doesn't have 0 oxygen, it just has lower oxygen. So that's why we're not saying deoxygenated. So poorly oxygenated blood is heading back towards the heart from the body through the superior and inferior vena cava, and those are both draining into the right atrium, okay? So the right side of your heart is the side that has poorly oxygenated blood in it. From the right atrium, we are going to travel into the right ventricle. And we'll have a look at the internal structures once we walk through the external structures. Then we need to pump the blood to the lungs to get oxygen. So from the right ventricle, we travel into the pulmonary trunk, and from there into the two pulmonary arteries. So left pulmonary artery is heading to the left lung. The right pulmonary artery is going to the right lung. Let's get rid of this for a sec so we can, there we go, so we can see our right pulmonary artery. Okay, so right pulmonary artery, left pulmonary artery, and it's the pulmonary trunk that's leaving the right ventricle. Pulmonary trunk isn't strictly on your list, so we won't pin that in a test, but you should be aware of right and left pulmonary arteries. Okay, all right. So then we go to the lungs, we get our oxygen, we're gonna flip to the posterior of the heart because now we have nice, happy, oxygenated blood, highly oxygenated, coming back through our pulmonary veins, okay? Left and right. And on a test, we would just label them and you can just say pulmonary vein, okay? You don't have to say left or right. You don't have to say superior, inferior. Just pulmonary vein is sufficient. Those will drain into the left atrium. So the left side of our heart is where the nice, good, highly oxygenated blood is. From the left atrium, that blood is going to move into the big, thick-walled left ventricle. The left ventricle has the thickest, most muscular wall of all of the chambers of the heart, and that's because its responsibility is when it contracts, it's going to pump the blood out to the rest of the body. So when that left ventricle contracts, I'm going to hide a couple of things here so we can get a better look. There you go. So here's your ascending aorta, and that is coming from the left ventricle, okay? So when the left ventricle contracts, it pumps the blood up through the ascending aorta. Let's add the rest of our aorta. We want the arch and the descending. Oops. All right, so let's put that away. So from our left ventricle, the blood gets pumped into the ascending aorta, then into the arch of the aorta, and that goes around the back to the descending thoracic aorta, okay? You'll also sometimes see this referred to as only the descending aorta, and this is just the naming of descending thoracic aorta is just to distinguish it from the abdominal aorta, which is the name of it when it crosses the diaphragm, okay? So in this area, you'll see it called either the descending aorta or the descending thoracic aorta, which is a bit more specific. Now I want to come back here a bit, and I see we've removed these. So the arch of the aorta has 3 branches, and I do want to talk about them while we're here because they are on your list. So arch of the aorta, and wow, that was a lot. Okay, it's a lot of things that just happened here. That's fine. Let's get rid of that and that. Okay, that's a little bit better. We'll scroll down a little and get rid of a few things because we don't need to see all of these branches right now. There, that's a little easier to see. Okay, so the arch of the aorta, as I mentioned, has 3 branches. Let's go down just a little bit more. Okay, the first one is the brachiocephalic trunk. If you want to call it the brachiocephalic artery, that's all right. This is a great spot for a reminder that when you are discussing arteries, nerves, or veins, it's extremely important that you write artery, nerve, or vein after the name. Or you can just write A, N, or V. And that tells us that you're talking about an artery, a vein, or a nerve. The reason it's so important is that many of them will have the same name, okay? So we have a brachiocephalic trunk or a brachiocephalic artery here. There's also a brachiocephalic vein, okay? So it's very important to always tell us if you're talking about an artery, a vein, or a nerve. The brachiocephalic trunk is quickly going to split to give us the right subclavian artery, which is headed toward the right upper limb, and the right common carotid artery, which is going up the right side of the neck. The next branch from the arch of the aorta is the left common carotid artery. Okay, so that's going up the left side of the neck. And then the third branch is the left subclavian artery, which is headed towards the left upper limb. All right, so next up, we're going to take a little view inside the heart. So for that, I'm going to switch to this view. Okay, and we're going to get rid of all of the arteries and veins on the outside. With the exception, let's put the aorta back. Where is it? Ascending aorta. Let's put that back, and let's put back our pulmonary, our pulmonary artery, I guess we want here, don't we? Pulmonary trunk, perfect. Okay, so we're looking at a superior view, so a top view of the heart, okay? So what you have here is your right atrium, okay? So this is the opening for the superior vena cava, that's the opening for the inferior vena cava, and we'll come down like this. So when the blood moves from the right atrium to the left ventricle, it's going to go through a valve. So I've removed the wall of the right ventricle here so you can see the valve, okay? And on the left side, you have the same thing. So from the left atria into the left ventricle, you have a very similar looking valve, okay? These are called atrioventricular valves because they're placed between an atrium and a ventricle. But the more common names for these are on the right, the tricuspid valve, and on the left, the bicuspid valve. And this is because of the number of cusps in the valve itself, okay? The cusps aren't easy to distinguish, and you don't have to distinguish them, but there's kind of one here and then one on the back for the bicuspid. For the tricuspid, there's a third. So there's one here, and then one on the posterior, okay? So in a test, you might use that as a little tip to kind of tell which is which, but the easiest way is just to remember the blood travels through the right side of the heart first and then through the left. And when we are buying a new dress or new pants or whatever, we always try before we buy. Okay, so the blood is going to go through the tricuspid valve before it goes through the bicuspid valve. So try before you buy. Now, the setup of these valves is really interesting. The cusps of the valve are attached to muscles here. These are called papillary muscles, and the papillary muscles are attached to the wall of the ventricle, okay? And then you have these very thin pieces of tissue called chordae tendineae, okay? I know the spelling on this one is tricky. We'll be fairly forgiving on this. And the chordae tendineae attach the cusp to the papillary muscle. Now, at first glance, you probably assume that the muscles are there, the papillary muscles, to pull the cusp open, but that's not actually the case. The way these atrioventricular valves work is when the pressure builds up in the atrium, it forces open the valve, okay? The blood comes into the ventricle, and then the cusp closes just due to the increase of pressure in the ventricle. Now, here's where the muscles come in. When the ventricle contracts to push the blood out to wherever it's going next, depending if you're on the right or the left, it's a very strong contraction. And our biggest concern here is that we will push blood backwards into the atrium, and we can't have that. We need all the blood moving in the right direction, or we won't get enough oxygen to all the cells of our body. So this is where the papillary muscles and chordae tendineae come in. They are going to act as anchors for the cusps of the valve to hold it shut when the ventricle contracts, okay? That way we won't get backflow of blood into the atrium. Okay, so that's your tricuspid and bicuspid valves. And let's put these guys back. And we will flip like this. Okay, so right heart, let's put everything back. Okay, so now we're looking at a superior view again. All right, so here's your pulmonary trunk. So when we leave the right ventricle, the blood goes into the pulmonary trunk and pulmonary arteries, okay? When we leave the left ventricle, blood goes up through the ascending aorta. Now, when blood leaves a ventricle, it also goes through a valve, okay? And let's have a look at these two valves. These are called semilunar valves, but the more common names here are the pulmonary valve. So the pulmonary valve is for when we're leaving the right ventricle, and the aortic valve, which is the one going into the ascending aorta. So that's when we're leaving the left ventricle, okay? They're called semilunar because they kind of have a half moon shape depending on the view you have of them. They don't have nearly as fancy a structure as the tricuspid and bicuspid valves. And that's because the pressure on the other side is nowhere near as strong as what the tri and bicuspid valves have to deal with. So these ones don't have to deal with the same kind of pressure and the same concerns about blood flowing back into the ventricles. Now, it is still a concern, and for that reason, even though it's not quite as strong, so these are structured a little differently. You can see that each cusp is kind of like a little pocket if you look at them from the side. So when we contract a ventricle and we force the blood through, that pushes open the valve. So each of these valves just squishes against the side wall and the blood goes through. Now, there will be a little bit of backflow in both the pulmonary arteries and the ascending aorta after the ventricle contracts. So what happens is the blood that flows backwards a little bit fills the cusps and forces them shut, okay? And then the blood will again move forward. So again, we don't need papillary muscles for these because the backflow is just not nearly as strong as what we saw with the atrioventricular valves. But these have the little cusp set up to prevent backflow. Okay, so I think the only thing left on our list today is the pericardium. So we'll go to this view. So the pericardium is the protective layers of the heart. And in class, we'll talk about these in detail because there are several layers, but we'll just do sort of a basic look at them here. Now, on a test, it's difficult to tell between the layers. So we're just going to ask you to label it pericardium, and that's sufficient on a lab test. So what we have here is the outermost layer, the fibrous pericardium, okay? And we hide that, you can see we have a much thinner layer, and this is the serous or serosal pericardium, which is a double layered membrane, as we'll discuss in class. Again, on a test, we will just, and then you have a lot of fat underneath, and the fat is just protective of all those little blood vessels. So if we put the pericardium back, so the serous pericardium again, and then the fibrous pericardium is that guy there. So on a lab test, we'll just ask you to call it pericardium because it's quite difficult for you to look at one of these pictures and tell if it's fibrous or serous. So you can just call it pericardium on a lab test. Okay, that's it for today. Have fun with the cardiovascular system, and we will see you next time.